Welcome to another episode of Caffeine, Chaos, and Critters. My name is Kaitlin. I'm sipping on a poppy today, hoping they sponsor me.
What, the orange cream flavor?
It is. It's really yummy.
I love that flavor. My name is Justin, and I'm drinking a Diet Dr. Pepper today.
Love me some Dr. Pepper. Maybe not diet, but love Dr. Pepper. Here's a little...
I feel like it's too sweet otherwise. A little ASMR moment. I don't think that translated.
Is that your stomach?
It was my throat.
I feel like that was louder than my can opening.
I didn't even hear your can opening.
That's crazy.
It didn't translate into the recording, unfortunately.
Sad. All right. Well, today we're going to have a little bit of fun. We are going to post about this on social media prior to this episode. So if you're coming here to see our reactions to something that we've posted on social media, hope you have fun. But we're going to talk about green and red flags when it comes to pet ownership. We're just going to throw out a bunch of random topics, and we're each going to decide if we think it's a green flag or a red flag. And then we are going to talk about fear-free. I think that's something that we both think is really important, but I know there's a lot of people out there who think that it's unrealistic.
Having a moment.
Okay.
For those of you who don't know, we usually have these for like 10 minutes before we record. Just get all of our laughs out in the beginning.
Well,
that clearly didn't happen this episode.
Okay. We're going to be talking about fear-free and whether or not we think it's helpful or important. And then Justin's going to be talking about pet insurance too, and the importance of that for pet owners out there, and the importance, I guess, for veterinary workers. It's important for us too. Yeah. Do you have anything to add before we get started? You don't have any giggles to get out?
Let's see if
Just me today. Well, I think we should just dive into the fear-free conversation first. That way we can save the fun bit for later.
So, I'm sure everybody knows what fear-free is at this point, right? Like, everybody should know what fear-free is.
Everyone should know. I feel like even clients ask me about it, so I feel like they have to know.
I feel like everybody should know what fear-free is at this point, but for those of you who don't, fear-free is essentially a certification that you can receive as a technician, but your practice can also become, or as a doctor as well, as a veterinary worker, there are courses that you can take online to become fear-free certified, but your clinic as a whole can also become fear-free certified. Essentially, it is giving veterinary medicine an approach that does not use fear as a tactic against our patients, because old school veterinary medicine was very fear-based, and we can be very kind of use that dominant thing that we see in the animal kingdom to control our patients in a way, which we found can cause just a lot of aggressive behavior from our patients, and they hate going to the vet because they've had such poor experiences previously. And so it's just a really crucial and important part of making veterinary medicine better in the long run.
Yeah. I mean, I started in vet med. I mean, God, I don't even know how many years it's been now in total, but I was 18, 19 when I first started, and I do remember the first practice I worked at, and I remember how we handled some of the patients, and back then that was normal to just get it done and get them out the door so that the owners didn't have to wait and it didn't cost them more money and all of this other stuff. But it was aggressive for sure. It was definitely traumatic for the pets. And, if your pet doesn't have proper training before coming into the vet and then that happens, they're never going to be good coming into a clinic setting again. Like I do feel like it really traumatizes them. Justin and I both worked at a practice that was fear-free certified, so we did follow a lot of the guidelines for years, both of us did. And I really do stand by it. I think it's important. I think if a pet is struggling and I have to force it down onto an x-ray table and it's screaming and flailing and hitting its head on the table, and because they will do that, that is not okay. And we need to stop, we need to pause, and we need to sedate that animal. In my mind, that's just how it needs to go. It's safer for the technicians too, who are handling the pet. It's safer for the pet and it's safer for the technicians handling the pet, in my opinion. I just don't think there's a reason to put them through all of that when we have drugs now that are safe, that can be reversed quickly to sedate them and make it a better experience. They don't even need to know what's happening if they're that stressed. It's not necessary for them to know. So yeah, I love Fear Free. I think it's great.
Well, and there's a huge encompassing thing when it comes to fear-free medicine. It doesn't only involve the technicians and the staff and the patients at the hospital, but it can very much involve the owners too, in making sure that your patient or your pets are having the most fear-free experience at the clinic. We as a clinic used to send patients home with, we call them PVPs, but it stands for pre-veterinary.
Prescription?
Is that what that was? Why did I think it was pre-veterinary prophylactic or something?
I don't know. I don't know if that's
But
actually what it stands for, but yeah, we call them PVPs.
and essentially it's just giving an owner enough medication to sedate the dog the night before and the morning of, to kind of help just make the transition a little bit smoother for the pet and for the owner.
Yeah, which is really good for pets who have anxiety, in the car and getting to and from places. That one was really awesome. And it doesn't knock them out for anybody thinking that we just sedate these pets at home. It just takes the edge off. That way they can come in already kind of chill, already kind of calm. And that also does help in clinic if we need to sedate them and they're typically very up here. Sometimes the sedation that we give in clinic doesn't work because their adrenaline is so high that they just override every drug we've given them. And so, if you can give those drugs prior and kind of take the edge off before you're even in the hospital, that helps with the injectable drugs that we can give too.
One is done at home in a comfortable space. They're usually sedated by the time the owners are getting them into the car, and by
Yeah.
that point, there's no overriding the drug when it's already kind of taken effect to that extreme. But honestly, just consider it like people who have anxiety at the dentist, you taking a prescribed benzo prior to you going to
Yeah,
the dentist to help you with your anxiety at the dentist. It's a very
literally.
similar thing.
Yeah, exactly. Exactly. And I think it works great. We've had to send pets home with it because they weren't behaving in hospital. And have them come back the next day. And it almost worked every single time. So really great for sure. The other thing too that's nice about Fear Free that I think is something that we should all be moving towards in veterinary medicine, and I say this almost every single episode, so y'all are probably tired of me saying it, but the other thing that Fear Free encourages is doing things with the owner around. So rather than taking the patient away from the owners into the back and stressing them out in a space that they're unfamiliar with, away from their people, you are doing it in the room with them ideally. So as many procedures and as many things as you can do in the room with the owner present, Fear Free encourages that. So I worked at an open concept hospital and I do not know how I could ever go back to normal hospitals where they do take the pets away. It just once you've done it, it makes so much more sense, so much easier for the clients, the pets, and for us, honestly. So, I think that that's another thing about Fear Free that I really appreciate is that it encourages it because it is less stressful for the pets most of the time. I know there's those
There are
animals
obvious
that,
exceptions, but
yeah,
yeah.
some owners stress their pets out, and so it is better to take them away.
Yes.
But that's not always the case. I think majority of the time they do really well when the owners are around. And believe it or not, I feel like the owners really appreciate that too. Just because they can be involved a little bit with the care and they can feel more a part of the treatment, you know? There doesn't have to be this like weird wall and weird separation between us and the client when it comes to helping their animal. So, yeah.
Period.
Yeah. Yeah.
Also, there are some patients who just like are so aggressive around their owners. I do think those are also some exceptions, like the ones that are uber protective that will like
Yeah.
attack you if you go near their owners.
Yeah.
Those are
Yeah.
ones that sometimes need to be taken away, but
And I feel
majority
like
of the
most of
time,
the time those owners know it too, and they'll just be like, take him away because he won't
yeah,
behave with me.
yep. They usually are very transparent about that, fortunately. It's either that or they hand you their growling chihuahua and say he's never bitten anybody before.
And then he tries to bite you like 4 times in the back.
Yep.
No, I really like it. And fear free is something that grooming facilities are adopting now. There are pet boarding facilities that are adopting it. They have a lot of programs now for employees of those businesses, so not just veterinary workers. So you can actually look up on the fear free website like grooming facilities and things like that that are fear free certified. So if you really like the way that it works and you feel like it's been better for your pet, if you've experienced that in a clinic, you can also use it for other services. It just basically says that this business is prioritizing your pet's like mental well-being. They're trying to make it less stressful. They're trying to make it just a better experience for them so that they're not literally stressing themselves to death. Like, you know what I mean? I mean, they can make themselves sick sometimes with how much they stress. Your cat is so cute.
It's
So,
being so extra right now.
so yeah, I think it's a thing that's kind of spreading. Like more and more people are becoming aware of it and utilizing it, which I think is great.
On the like grooming side of things, I think that's so important, especially for groomers,
Need to be more involved in that 100%.
because I feel like the dogs that get groomed are typically some of the worst patients to deal with.
Mhm.
And I
Mhm.
think majority of the time it's because groomers tend to like manhandle them
Yeah.
when they're
Yeah.
grooming them. Like,
Which, there's like I understand it from their end because like people like don't accept groomers saying I can't handle your dog and he's not getting groomed today. Like they don't accept that as an answer and they're like no, you need to get it done. And so I think sometimes they're just put in a position where they feel like they have to do it, which still is not appropriate. I still don't agree with it, but it's tough cuz people expect a lot out of groomers, I feel like.
oh yeah,
They make one little mistake and it's like the end of the world.
and
And I
majority
can
of the
say that as
time
a
it's not
person
even
who,
their fault.
yeah, like I took my dog to the groomer and I mean, she got a horrible like furunculosis like all along her back from grooming. And I didn't shame them. I didn't call and bitch anybody out. I was very kind and I was like, "Hey, your equipment I think was dirty and my dog now has a skin infection. No big deal. You guys have always treated me great. You've always treated her great. Whatever." And then they just paid for my vet services and we called it even. It was all good.
That's how it should be handled.
Yeah, I do think they get a lot of hate. So, but that being said, dogs do get very stressed at the groomer, like very, very stressed. And I think if owners were more aware of that, or maybe even brought it up with their veterinarian so that they could get sedation medication for their pets before they go to the groomer, I think that would be so great. Because again, it is detrimental to their health to be that stressed. Because from a dog's point of view, like they do not understand what's happening. And there's machines buzzing around them and people plucking ear hairs out. And like, I mean, that's got to be a lot for them. So just be aware of that if you groom your dog. And if your groomer has ever mentioned that your dog is nervous or doesn't do well, just get meds for your dog. It's just so much easier for them and the groomer.
And you'll have a better haircut.
Yeah, exactly. Because the groomer will have an easier time. Yeah, I don't know. It's crazy. But yeah, fear free is great. I think definitely groomers should utilize it more. I think it would be helpful. And I think if they utilized it more and they got the training and all of their staff was trained, they would be able to better educate and explain things to owners because of it. Like, I think it would make education to owners a little bit easier for them if they like prioritized having their employees go through that training. I
Oh,
think it
yeah,
would help. Yeah.
for
Yeah.
sure. Although I will say, I do love Fear Free as a whole, and I think I've taken like a lot of things from Fear Free, even though I do no longer work at a Fear Free practice. We do still, I think, like as a whole, prioritize like our patients' mental well-being, and like we do practice fear-free medicine even though we don't maybe have the title. I think on an ER basis, fear-free can be a little bit difficult, and sometimes it can hinder care in an emergency setting. And so I love fear-free, but I do think that sometimes it doesn't necessarily have a great place in ER for certain patients and for certain circumstances. And I'm not saying that like we shouldn't be trying our best to use fear-free in an emergency setting, but when it's between, technician safety and me scruffing a cat, I'm going to scruff the cat, for example, which for those of you who don't know, Fear Free, scruffing cats is like an absolute no-no in
Yeah,
Fear
you're not
Free.
supposed to do it at all. Yeah.
Like you can scruff very young kittens, but that's like the only thing that they recommend scruffing. But I will say that I will still scruff cats, mainly just because I'm in an ER setting and sometimes the cat's losing its shit, but it's also very sick and it needs the care. And so, it's just kind of like a weird teeter-totter on ER of balancing patient care with patient safety and technician safety, and whether or not this specific circumstance is appropriate to like practice 100% fear free.
Yeah, no, I think that's a really like great point to bring up, and that's probably the thing or the issue that a lot of people have with fear free is that they're like, "Oh, but in these situations it just didn't work out, or I couldn't do it here and I couldn't do it there." And I do think there are times when it's really difficult to practice like 100% fear free. Like you said, especially on emergency because we're usually in a hurry. Like the pet is there for a reason. It's not just, you know, a wellness check and we can have them come back in a week with their, medications. This is like we have to figure out what to do right now. And sometimes that requires treatments or handling that may still be stressful to the pet. Like examples I can think of are really aggressive dogs. And I've had cases where the dogs have like a laceration on a limb and it is bleeding everywhere. But the dog
Mm-hmm.
will not let you touch it. And there have been times when we've had to, you know, get like a rope muzzle on them. We've had to use the door method where you stick them in between the door and poke them in the booty that way just to sedate them because they just will not let you touch them. And it's like, we need to get you knocked out like right now. Like, we got to do this. And so, like, yeah, there have been some situations where like the pet comes in already stressed because it's on an emergency. Like in my example, they have a laceration, they're painful, they're already stressed out. And so our only option is to just use restraint and then get them knocked out as quickly as possible. It's not always ideal, but sometimes if it means like saving the animal's life, we got to do what we got to do.
And we worked at a fear free certified emergency general practice combo, and so I think sometimes we get flack for some of the stuff we did
Yeah.
on an ER basis that like maybe wasn't fear free,
Yeah.
but we were doing what
I
we had
think,
to do for the specific circumstance.
yeah. And I think in general, I mean, in general, we were doing exactly what we were supposed to be doing. It's just there are definitely situations where it's really hard to, like, you literally have to choose between the patient's well-being and getting it the care that it needs and trying to sedate it. Like, here's a good example, actually. When I worked at that practice, I had a patient that it was not an aggressive patient really, but every time you did anything with it, it would scream bloody murder. Like it was just one of those dogs that every time you touched it, it was just scream, 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 like sounded like we were murdering it and we were just like picking up its paw. You know what I mean? Like one of those dogs. And so we had to hospitalize it. It was a little bit of an older dog, like medium size. I think it was like a Queensland mix or something like that. And we were trying to get an IV catheter in this dog and we wanted to sedate it first so that we could get the IV in. get it prepped, put a cone on, and do all the things that we needed to do without it screaming and struggling the whole time. We tried to sedate this dog multiple times, and despite like leaving it in a dark room, in a kennel by itself with like calming music, we tried like everything. We went in and I think we tried to sedate this dog 4 times and it just would not go down. It would not go to sleep. And I was at a point where we've already poked the dog with a needle 4 times. How many more times do I need to continue to poke this dog to sedate it when in reality, all I need is an IV? So in my mind, the dog wasn't going to go down anyway. It was clear that we've given it a ton of drugs and it was not getting sleepy at all. It was just overriding everything we gave it. And so I made the decision to just place the IV despite the dog screaming and being uncomfortable. And granted, we got it in pretty quickly, so it wasn't a long ordeal. And of course, you feel bad because the dog is screaming, but the dog would scream also every time we poked it in the muscle to try to sedate it. So it was like you had to weigh your options in that scenario. And the dog needed fluids; it needed to be hospitalized, so we needed to get the IV in. And I made that decision. And that's definitely a decision that I was talked to about it because the dog was awake and it was screaming and that was not fear free. So I was definitely talked to about that situation by management. But I just felt like in that moment, I didn't want to keep stressing the dog out over and over and over and over again in an attempt to make it fear free. We weren't making it fear free anyway. So that's just another scenario I can think of where, like, hey, we got to do what we got to do here. So,
Yep.
yeah.
And I feel like with cats specifically, fear free can be really hard.
Mm-hmm. It can be, but I think also a lot of people underutilize fear-free practices in cats and end up stressing them out. The one thing I see in clinic with cats more than anything is people not being able to lower their voice when talking in a room with a cat. That doesn't sound like a big thing, but it makes a huge difference for cats. They should not be in an environment that is super loud and overstimulating. If you're busting into the room, talking super loud to the owner, waving your hands around, and just making it this whole big thing, that scares the cat. If you approach them super quickly and yank them out of the kennel, that scares them. Like, I think I've seen it so many times where people don't even think about that because they're just in their routine, they're going about their day. And that is like such a small thing that helps cats tremendously in the hospital. Just being very quiet, moving very slow. I really like the pheromone thing. I know a lot of people are weird about that, but feel away, I really like it. So, I mean, sometimes it is difficult with cats who are just extremely aggressive. Sometimes you gotta stick them in the clam and you gotta sedate them. But I really think, like, I don't know. Everybody grabs me for aggressive cats in my clinic because that's just like, I'm like, don't touch it, be quiet, let me do it.
Cat
And listen,
whisperer.
that's what they call me. I just think cats speak a different language and people forget that sometimes. That's all. Yeah,
We try and treat them like they're dogs, and they're just not.
they're not. And they can be assholes. My cat is an asshole on the regular. So I get it, but I don't know. They just speak a different language, that's all.
Spoken like a crazy cat lady over here.
I was literally just gonna say I'm a crazy cat lady. I don't know. You just gotta be gentle with them. Even if they're like literally swatting at you and hissing at you. Like you gotta be like zen. You just have to be.
I can clam a cat so easily.
But that's the thing. If you can go in there with confidence and be like, we're gonna do this, you put them in the clam, you cover them with a towel, you turn the lights off in the room, you get quiet and you sedate them. And then it's like, woohoo, that was it. I don't know.
That is sedating an aggressive cat is one of like the main skills I think I developed from our old job together.
Yeah. Honestly, same. Yeah. Because there was a lot of like things that we had to do in order to like remain fear free, I guess, when handling aggressive cats. And it really helped.
It does. I still use a lot of those skills today.
Yeah. Yeah. It
I will
can
say
be
though,
done. Can be done.
It can. I will say though, the clam that we have at my current job is like, I miss the one from our old job so much.
Oh, really?
Like, I
Not
just
the
love
same.
the like thin metal ones that have like the blue,
Yeah.
like the thin metal bars with the blue net on them. The ones that
Yeah.
we
That's
have
the
are more like
one. That's the one
they're
that
more
we
like
currently use.
PVC pipe almost with like a net in there, and it's just
I don't
like
like that already.
it's so much harder to grab them with it because the
Yeah, I
PVC
bet.
piping is just like so thick. Can't do it as swiftly.
You got to talk to your inventory manager about that. Get you a new
Heard.
one.
I also still to this day use the walking stick method for giving drugs.
Oh yeah, me too. It's a great one.
Most of the time, they don't even notice you poke them.
Sometimes they do, but yeah, I agree. It's a good one.
And for those of you who don't know what that is, essentially, you take like I usually will try to use a micro extension if they're available because it's so much less priming to the line.
Yeah.
But you just like pull up your drugs into your syringe, attach a micro extension, attach a needle to it. I will typically try and pull up as much, like I'll pull up a little bit of air to quantify how much air is or how much like room it takes to flush through the micro extension.
Yeah,
Does that make sense?
kinda.
Um,
I know what you're talking about, but I would say, yeah, you flush the drug that you've pulled up into your microline, which depending on what type of microline you have can be like what between
they're
0.4
usually like a
mil.
half of a cc.
Yeah, they're nothing. But if you're giving this to a cat, that's going to take everything that you just pulled up, your 0.4 mil. And then, yeah, I usually will put 0.4 mil in the syringe of air and attach it. That way, when you push it through, it gets everything in the line into the
Into the
patient.
patient. And like you might get a tiny bit of air intramuscularly, but it's not going to harm the pet.
Not when they're flailing around acting crazy anyway.
So if
Yeah. No, I'm glad we had this conversation. I think it's like, I do think I think fear free is mostly popular like in the veterinary world now. Like I feel like majority of people know what it is, but I will say like I've run into a couple of students that I go to class with that like have never heard of it and like still use like ISO to like box down angry cats. So tell your friends to please look up fear free if they're still using ISO to box down cats because that should not be a thing. Just saying. But yeah, be nice to your kitties. You just need to be calm with them.
try to utilize fear free as much as you can.
Yeah. Well, on that note, do you want to talk at us about pet insurance?
Yes, yes, yes. So, pet insurance, as you all know, is a great resource for pet owners and for clinics, but it can also be a great hindrance, I feel like. And I think a lot of it is just people don't do their research and people don't understand and they're not educated about how pet insurance works and how it differs from human insurance. Like they expect it to work the same way as it works when they go to the doctor.
Mm-hmm.
And unfortunately, in veterinary medicine, if you have pet insurance, like that's amazing and it'll save you a lot of money. But if you don't plan for and have the finances available to pay for the care, it doesn't do you any good.
Mm-hmm.
Because for those
Yep.
of you who don't know, pet insurance usually requires that you pay your bill at the clinic that you're at, and then on your own time, you submit for reimbursement directly to your pet insurance, and then they send you a check to whatever they cover to just reimburse you for that expense. Typically, we don't have an option to bill directly to pet insurance, just like we don't have an option to directly bill an owner for care. So if you are going to get pet insurance, do your research and make sure that it's a viable option for you and you still have the financial backing available in some way to be able to be financially responsible for the care.
Yep.
As a clinic, we're not just going to take your word for it because you said you have pet insurance. That puts us
Right.
in a bad position. So if you are looking for pet insurance and you do not have the financial backing to pay for care, there is an option for you. I don't know if any of you guys have heard of Trupanion, but it is probably my favorite pet insurance, because Trupanion is the only pet insurance that can pay a clinic for care.
I didn't even know about that.
So for those of you who are looking for pet insurance or you're looking to change pet insurance because you don't like the one that you have, I definitely recommend looking into Trupanion. I don't know if they do this with every clinic, but like my emergency facility that I work at is set up with Trupanion to be able to get paid by Trupanion directly, and they'll just preemptively pay for the care that they would cover anyway, and then the owner is only financially responsible for whatever they don't cover.
That's amazing. And I just Googled it because I wanted to make absolutely sure that we were telling the truth. And it says so right on their website. So that's really cool.
Yeah. And I do think that Trupanion can also pay clinics that aren't set up to get money directly from them. And I think that's more of a newer thing that they're starting to do. But it's an amazing resource for people who want to look into pet insurance and want it to work more like a human insurance would. And they do pay us fairly quickly. Like within 3 to 5 minutes of submitting a claim, we normally have approval and money from them.
Wow. That's amazing. Do you think it would take me very long to get a quote, like for a healthy animal, just so I could tell people who are watching? I'm just gonna very quickly run through this.
I don't think it would take very long. But while she's doing that to look and see kind of what the process looks like, I'm going to continue my talk about pet insurance. Another thing that I wanted to mention is you also need to understand, because I've had clients ask me in the exam room, can I apply for pet insurance now? And unfortunately, typically they do have a period of time where you're not covered by the pet insurance, just because they don't want people applying for pet insurance the day of an emergency, and then using that pet insurance the day that they sign up for it, because it's technically insurance fraud. Essentially, it would be considered a pre-existing condition, because your pet already had the issue prior to signing up for insurance. So it's something that you have to preemptively prepare for. So if you have any consideration of getting a pet, or you have a pet who's very healthy at this point, now is the time to consider pet insurance, and now is the time to get that arranged and sign up for it. They also will look through all of your pet's previous medical history and all of their previous medical records. So if your dog has already had a foreign body surgery, and you sign up for pet insurance, typically there's a time period of time where that procedure is no longer covered. So also do your research on that. I do know some places will be as long as your pet is insured and goes 12 months without having to need foreign body surgery, we will then start to cover them in the future. So just make sure your pet insurance allows that kind of stuff, and you do what's right for you and what is going to best, best help you in the future.
Yeah. Yeah, no, I think that's awesome. So I did just get a quick quote. I used my cat as an example. She's 4 years old. She's spayed, domestic short hair. I didn't put any health conditions in, and it says you can choose your deductible. If you want a $650 deductible, it's $56 a month, and if you want a $300 deductible, it's $82 a month. Might not be a possibility for every person out there, but I think if you are a person who could afford $700-800 for your pet in one sitting, at a vet visit, this might be good for you because you could hit your deductible and it's only $56 a month.
Yep. And honestly, everybody needs pet insurance. You're gonna need it eventually.
Yeah.
And the longer you wait to sign your pet up for it, the more expensive it's going to be to pay for.
That's true. Yeah.
As your pet gets older, they just are more expensive to insure because they're more likely to have health issues and so on and so forth.
Right. Makes sense.
So
Yeah, I think it's definitely an up and coming thing. I guess the only downside that I see to it at this point is just that there are still going to be people who can't afford to pay monthly fees for pet insurance. Like if you did the $300 deductible, it was like 80 something bucks a month, and I think that's kind of a lot for like lower income people. So that would be the only downside. I think though, as it becomes more popular and more people take part in it, there's definitely a chance that those monthly fees could come down. Because I'm sure part of the reason that they're so high right now is just that they don't have like a ton of customers for that. So yeah, hopefully more people get in on it. But it's a great thing. I've seen it many times come in handy in ER situations where they come in and their pet has a fluke accident and the bill ends up being like 7-8 grand, and a lot of times they can get majority, if not all of that, covered by insurance companies. So they do have to pay it up front, like Justin was saying, but it's just so nice when you need it. Well, I don't have anything else to add about pet insurance.
that's all I really had to say about it. I just wanted
Yeah.
to make sure people were kind of aware of the perks and downsides of it and ensure that
Yeah.
people know how to do their research and make sure that they're making the
Yeah.
right move.
Yeah. And if you're familiar with human health insurance and all of the stuff that goes into that, all of the nonsense, I'm sure it's pretty darn similar in the vet world. So, all right. Well, we were going to talk about so I quite literally asked ChatGPT to make me a list of pet owner like qualities, good and bad. And so we're just going to like kind of go through a list, and we're each going to say whether or not we think this quality is a green flag or a red flag. I wish we had like actual little flags to wave around because that would be way more fun, but
That would be kind of fun, yeah.
we didn't think about it that far in advance, I guess. So I think I'll go through one of the sections and then maybe Justin can go through the other.
That's fair.
All right. So the first little group is emergency and preparedness. So the first quality is knows where the nearest ER is. Green flag.
Green flag.
You should definitely know the closest ER to your house. Definitely.
And that just like shows that the owner cares and is aware of the potential need for pet care and where to best get that pet care in their area. I feel
For
like this is
sure.
also a pretty good indication that you probably take your pet to the general practice facility regularly because you were probably referred to us by your general practice.
Yeah, definitely. All right. Second one, has never thought about emergency care for their pet. Red flag.
Red flag. This
We
is
just talked
quite
about
literally
this. You should know.
this is quite literally the exact opposite of what I just said.
Yep.
This person does
Yep.
not take their pet to their general practice. This person does not get regular vet care.
Yeah.
No bueno.
All right. Next one. Calls ahead before arriving at an ER.
Yellow flag.
Can I? Yes, I was gonna say, can I say beige flag? Yellow flag is a good one. Um, yeah, because you don't need to do this. It's
Yeah.
helpful sometimes if you have a pet that's like seizing in the car or like is going to need CPR immediately, or maybe needs like a gurney because it's a large breed dog that you can't get out of the car. Definitely call ahead and say, I'm whipping in 5 minutes and I'm going to need help in the parking lot. That's helpful, but it's not always necessary to call ahead because it's a walk-in facility. You come in and you get the care the same that anyone else would get the care. So not always necessary.
If you have like a critical dying thing, it's very helpful. Otherwise, I feel like typically people who call ahead before coming into the ER, maybe this is a generalization, but I feel like they generally don't have money.
Mm-hmm. And
Because
they want
usually
to
they're
know.
calling ahead to get a price quote and they want to know how much it's going to be to get out of the door, and we're not able to tell you that.
Yeah.
So I feel like they typically just don't have the financial means to take care of their pet.
But yeah.
That's just my experience.
All right. Next one. Shows up angry about the wait time. Red flag.
Red flag for sure.
That just means that you weren't prepared before you came here, aka you didn't know what you were getting yourself into and you didn't look it up beforehand. Or maybe you've never been to a human ER and you just have no clue how any of this stuff works. And also, like, if there's a wait time, it's for a reason. It's never just because. So there's stuff going on behind closed doors that you cannot see and you do not understand. So
Generally, you're waiting a long time because
be
a lot of
nice.
people aren't going home with their pets today, and you probably will.
Exactly. That's exactly it. I'm gonna skip the next one because I feel like that doesn't really make sense. Brings records when transferring care.
Ugh, green
Green flag.
flag.
We love someone who shows up with all of the needed information. That is super helpful. Always do that if you are able to do so.
I also love clients that like bring a folder of all their pets' care. Like they have like a designated folder of all of their pets' medical records, and they just like bring it in, and it's got like a printed out blood work from 6 months ago. Oh, those people are
Yes,
just
that's
A1.
me. I have a folder.
Same. My folder
But
doesn't have a
yes,
lot
definitely
in it,
green.
but I do have a folder for my
Same.
pets.
Same. It has blood work and stuff though, most recent. Last one. Expects instant results in critical cases.
Yellow
Red
flag.
flag. Why yellow?
This is just me giving owners grace. I say a yellow flag because like I understand the desire for their pet to be instantly better.
Yeah.
And like I understand that it's coming from a place of love and like they care about their pet. But I still select yellow flag because it's not feasible, and anybody who has like common sense should know that your thing that came in actively dying isn't going to be better tomorrow.
That's valid. That is totally valid, and I think fair, because like you said, it's probably just coming from a place of them caring about their pet. I say red flag because of your last point there, though. Like, you should know if your pet is really seriously ill that, if your grandma was really seriously ill and in the hospital for something, you would want her to stay there as long as necessary in order to get better. And I think it's the same thing, for pets. So just remember that when you go in. But
I think this could also mean though, like owners who get upset, like visibly upset with us when we don't know why their pet is as sick as they are, and like
yeah,
wanting instant results as far as diagnostics and figuring out a definitive diagnosis, but sometimes that takes several days to figure out. I don't think they realize that a lot of the testing that we do does get sent out and does take several days to come back and process and get results from. And I'm so sorry, but science does require we're gonna run tests and they're gonna come back negative, and we're
hmm
still not gonna know what's happening, and we're gonna have to do other tests that cost more money. But as we say, we do not have a crystal ball to just tell you what's wrong with your pet. It
yeah.
is
And sometimes
unfortunately
we can do all of the tests in the world and still not
never
fully
figure it
understand
out.
what's going on. So
Yep,
it'd be like that sometimes.
that do.
It'd be like that in
Medical
human medicine
mysteries
too.
do exist.
We do. We definitely do. I don't know if you want to take on the next section.
Yes. So the next section is called Veterinary Care and Attitude. And this one's a quote. I only go to the vet when something is wrong. Red flag.
Red flag.
Sorry, I never
Red
know like
flag.
when we're both gonna say it or not. So
I know we're not great at that, but yeah, you should definitely be doing regular visits. I am a huge advocate for getting at least bare minimum full labs. CBC Chem, And then if you're in a state that has like valley fever or tick fever, things like that, I also recommend getting those tests at least once a year. On
Heartworm
both cats and
test.
dogs, heartworm tests for sure. Just basic stuff to make sure that your pet is healthy, that there's no major changes, that we're not suddenly seeing issues with kidney or liver. This can prevent a lot of issues from occurring down the road, or we can catch things really early and we can treat it and they can
Mm-hmm.
live longer and have better results. So I just really think that baseline blood work and some of those, infectious tests should be done once a year, bare minimum. And I know, again, some of that is expensive and not everyone can afford it. Even if you're just going in for a physical exam, that's better than nothing. There are things that your veterinarian may catch on exam that you wouldn't have known about otherwise. So definitely at least do your exam.
Yes, absolutely. And I feel like doing the exam and blood work is like bare minimum. If you really want to go
Mm-hmm.
above and beyond, like as your patients get older, you should be doing like yearly chest rads on them as they start to age, things
Yeah.
like that too. Looking for mets and things.
Let me put it to you this way. People don't realize how quickly some of these things can occur. I had x-rays and full labs done on my dog in February, and in July, she had a horrible cancer that we had to euthanize her for. And everything was normal in February. That being said, it can happen very quickly in our animals, and so it sounds like a lot doing that once a year. It's not. They age a lot faster than we do, and things can happen very quickly, which obviously happened
Mm-hmm.
with my pet as well. So, yeah, it can happen fast.
And they
So make
just
sure you check.
deteriorate so much quicker than I think that we realize.
Yeah. All right, next.
Ooh, the next one is has pet insurance or a dedicated emergency fund.
The
Yellow
greenest of
flag.
flags.
Yeah, I say yellow flag.
Why?
So listen, I love this, but some of these people who do have both of these things are sometimes the most unrealistic people you will ever work with.
Okay, I
And
guess maybe. I honestly, let me be for real. I don't know that I've ever experienced anybody that has both pet insurance and an emergency fund both ready to go. I've never met a client like
fair.
that. So I don't even know where those people are from or what they're like.
No, that's fair. Usually it is one or the other. They typically have pet insurance or they have like an emergency fund for their pet. But I find that people who have an expendable amount of money to spend on their pet will do they're just doing the most sometimes, and
You
they
mean
tend
like
to not be
maybe they're
realistic. And
doing too much and it's affecting quality of life sort of thing? Or like, what do you mean by that?
yeah, I think they do too much, and it affects the quality of life of their patient. Just because they
Okay.
have the money for it. It's one of those scenarios where it's like just because we can doesn't mean that we should.
Mm. Yeah, I hear you. That makes sense.
The next one, questions recommendations respectfully instead of dismissing them. Green flag.
Green flag. That's just self-explanatory.
Yeah, I feel like that's just an owner being curious and just wanting to know all of the information.
Yeah, which is totally valid. Um,
And
you
there
are your
should be.
pet's advocate, so yeah, definitely. Definitely. I question things for my animals as well, so but respectfully.
I also question things from my patients
Yeah, fair.
because next to the owner, the technician, I feel like is the next advocate for them.
Yeah, that's valid.
I am not afraid to be like, why are we doing all of this?
Heard. Yeah, I've been there before too. I'm like, listen, this is not it. You should not be doing this.
Yeah.
I've also had conversations with owners, like after the veterinarian had the complete opposite conversation with them and been like, listen, I know they're giving you hope, and I'm not trying to take away hope, but we also need to be realistic. Don't forget that.
Yes. Well, and sometimes I just think there are doctors that just like do too many diagnostics, and they understand that it's coming from a point of like providing gold standard care to the pet and like doing everything that we can.
Yeah.
But sometimes there's a fine line that needs to be walked in that situation. And we don't need to do every test under the sun to figure out what's going on.
I agree. Yeah. Sometimes it is overkill for sure.
The next one is, this is another quotation. I Googled this and it says ... red flag.
Red flag. Don't use Dr. Google. You can
No,
use
we
Dr.
don't like
Google
Dr.
after
Google.
your pet has been diagnosed and you want to learn more about the diagnosis. Then you can use Google. I'll allow
Yes.
that. But you should
never
not be
Google
trying to
symptoms.
figure out, because vomiting and diarrhea is a symptom of literally everything under the sun. So if you look up vomiting, diarrhea, coughed a few times today, whatever, and ChatGPT or Google tells you this or that, they have no clue. They don't have x-ray vision either, and you need diagnostics to know what's happening. Don't come in there saying, well, I looked this up and I'm pretty positive it's this. Because sometimes we're going to look at you like, you're crazy. There's no way it could be that.
Period. The next one is willing to hear multiple options and outcomes.
I think green flag.
Green flag for sure, yeah.
Yeah, I
This
think
is
that
just like
goes
a
without
realistic
saying.
owner.
Yeah.
Yeah, this to me is just like a very realistic owner who wants to know as much as they can about the situation that they're in.
Yeah.
We love that.
Well, I think the next one is our last one, but I think the best one.
Refuses diagnostics but expects a guaranteed answer. Absolute red flag.
Boy, do we experience that on a daily. Red flag. Yeah,
Far
for
too
sure.
often.
Far too
How do you
often.
not know what's wrong with my dog? How do you just like not know?
How do you not have the ability to see inside my dog's chest without taking an x-ray? That's crazy. Yeah, it's a struggle every day for real. People,
It sure
and you
is.
know what? I know that it comes down to finances, and I know that people are like, how can I help my animal without spending a bajillion dollars? I get it 100%. But again, you have to remember that there's only so much we can see on exam. We can't tell how the liver is functioning or the kidney is functioning, or, we can't see the health of your pet's digestive tract. What if they have, we can't see anything on just like looking at them. The information that we can gather from a physical exam is like lymph node size, listening to their heart and lungs, gum color, dehydration status, like things like that. That's what we can gather from a physical exam. Beyond that, it's really difficult unless there's like an obvious tumor somewhere, to know like what's happening. So,
because essentially the way that it works is like the doctor takes their exam findings and the owner's history, and together those give you differential diagnostics that they then, or diagnoses that they then work through. That's just how it works, and it's the only proper true way to be able to figure out what's going on.
It's like solving a puzzle, honestly. You have to take one piece at a time and put it all together and try to figure out what's happening from everything that you've been given. It's literally like solving a puzzle. Again, only one piece of the puzzle is physical exam. So it's really hard to fit it all together with just that, if that's all you have. But to end it off for this episode, we normally do our little chaos corner, and I wanted to do like a wellness corner this week because, us people in the veterinary field, we don't take good care of ourselves most of the time. So to encourage you to do something for yourself, Justin and I just wanted to give some tips, something that we've utilized in the past that has made it easier for us to get either through periods of burnout or just when we're having a hard week. So we're just gonna, we're gonna do a little wellness corner. Okay. Well, my thing is kind of cheesy, but this is something that a therapist of mine years ago told me to do when I was really struggling with burnout in the field. I was having a really hard time enjoying things outside of work because work was stressing me out so bad. And she basically made me write a list of at least 10 things that brought me joy. And it can be something as simple as literally sitting on the couch watching your favorite TV show for an hour. It can be taking a walk around the block, walking your dog around the block. It can be just anything that is not work related that just brings you joy outside of work. And she told me to commit to doing 2 of those things minimum per week, just to make sure that I'm doing things that make me happy and that can take my mind off of the stress that I feel at work. And it also encourages you to just actually sit down and think about the things that make you happy. Your cat. And things that you really like to do, the hobbies that bring you joy. It can be, I mean, having brunch with friends, it can be talking with your mom on the phone, it can be any of those things. Just something that is for you every week. It doesn't involve other people, it's for you. It's something that makes you happy and brings you joy. So, if you are struggling right now and you're having a hard time or you're just going through a period of time where you've really struggled to focus on yourself, maybe try this. Because it's simple. It doesn't need to be hard. You don't need to, like you don't need to commit to doing an hour workout every day of the week as something that brings you joy. You don't have to do something like that. It can be simple, but just to help you get through a rough period. It helped me. I feel like it helped me a lot. So, yeah, that's my thing.
For me, I think the main wellness tips I have is one, if you don't have a therapist, get one. And I think that's just so important because taking care of your like mental health outside of work is
My
going to
cat
be.
sees your cats. I'm so sorry to interrupt. It's
She's like,
like
oh my god, this is like
he's watching them.
one of a very few times where she's made appearance, so we'll take it.
I know. This is Mew, like the Pokemon.
Yeah.
He's
But
over it.
taking care of yourself outside of work, whether that be more so like maintaining a good mental health, whether that be just talking to a therapist or like seeking a psychiatrist if you have severe enough mental health issues, and like getting on meds and getting on a treatment plan that works for you. But also making sure that, like Kaitlin has said, another one of my big things is making sure that you're partaking in things that bring you joy outside of work. For me personally, I've been started on depression meds, and then I've also been trying really hard just to partake in things outside of work. Like I started a pottery class and things like that, and doing those things mixed with meds and like making sure that I have a life outside of work has just tremendously helped me. Like, not only do I not dread going to work anymore, like I'm not dragging myself out of bed to go to work. I actually enjoy going to work again.
Yeah.
And I don't allow it to just like basically crumble my mood and crumble me. Take
It
care of yourself and do things you
yes.
love.
Yes. And it doesn't seem like much. Like I feel like, going to therapy every couple of weeks and whatever. I think a lot of people have this idea in their head that like it's so bad and I'm struggling so hard that there's nothing you can do to fix it. It just is what it is. And that is so not true. And I can say that because I went through a period of burnout that was so bad that I did nothing outside of work because I was just depressed and over it for like 6 straight months. And I seriously, seriously, seriously wanted to leave the field. And I was in the middle of literally undergrad to go to vet school. So, I was faced with this choice of, do I completely change my career and change what I'm going to school for because I'm going through this period of time that's really difficult? But I came out of it. I had a really great therapist, and I honestly bless her. Because I think without her, it would have been a lot harder. But it was just very simple little like tweaks to my everyday life that like made a huge difference. And I'm the same way now, where I don't dread going into work and it's not this horrible thing and I don't think about it all week long. And you just have to, you really like simply put, you have to just find things that you enjoy outside of work that allow you to decompress from it.
And as always, take care of yourselves like you would your patients.
Yes.
Love you
Bye,
guys.
guys.